Somalia's fight against the COVID-19 virus has been overshadowed by its political turmoil. While a new civil war could cost thousands of lives, there is no telling how many have died from the coronavirus or how many will in the future. Officially, less than 800 people in Somalia have succumbed to the virus, and less than 15,000 have been diagnosed with COVID. But only 156,000 out of 15 million people have been tested. That is 0.1% of the population. These are predominantly those in Mogadishu, with more opportunity to be exposed to the disease. If those numbers were consistent throughout the country, though, 76,000 would have already perished from the virus. If the virus spreads outside the capital, the numbers could be worse, as there is little protection or treatment to be had. COVID-19 could run wild through local populations. During the first wave in April to June last year, investigative journalists revealed that gravediggers were burying 4 times as many dead as usual. Official statistics show that 3 times as many people have died in the last 3 months than in the last 9 months of 2020. The coronavirus is the most likely culprit. Most Muslims are buried within 24 hours of death, and if COVID wasn't detected previously, it is unlikely to be recorded as the cause of death. Somalia received 300,000 doses of the AstraZeneca vaccine. Less than half have been injected into potential victims. Even if all of the vaccines were used, it would only protect a very small fraction of Somalia's population. It is reported that many Somalis didn't want the jab during the Ramadan holiday while they were fasting. Others have misperceptions about the COVID vaccines and vaccines in general. And the Al-Shabaab have been campaigning against inoculations. So much of the healthcare system in Somalia emanates from foreign organizations based in Mogadishu. Most are bunkered down with the United Nations near the airport, staying clear of terrorism and the virus. They depend on local organizations to transport supplies and provide information with little supervision. With minimal testing, even less contact tracing capacity, and low vaccine uptake, information, mask wearing, hand washing, and social distancing represent the best tools to fight the virus. But touring around Mogadishu, especially as people prepared for Eid, there is little evidence that coronavirus protocols are being observed. Politically motivated conflict, Al-Shabaab terrorism, and hunger all seem more dangerous to most Somalis. But the creeping death from COVID-19 might be killing more Somalis than all of these. ADN TV salutes the medical workers in Somalia who are combating the coronavirus and so many other health challenges.